Hi guys, my name is Kelly. I'm with Mid-Peninsula Moms Blog, and we are very excited to be here again with our contributing writer and sleep expert, Dr. Sarah Mitchell from Helping Babies Sleep. I do apologize, I'm getting over a cold. Hopefully I will survive this Facebook Live session without a cough attack. Today we are talking about the 5 reasons that your baby wakes up too early. I love this. Can I tell you, I love this because usually when we talk about sleep issues or sleep training or sleep teaching, as we said,
Right.
sleep teaching sounds so much nicer. We talk about how to get our babies to go to sleep, how to keep them asleep, how to wean from feeding them in the middle of the night. But this is actually like from a different angle. It's on the other side of the spectrum. How do we keep them to sleep all night long and not wake up at the crack of dawn?
Right. Well, you were asking me before the Facebook Live, what is too early?
Yes.
And we deliberately titled it Too Early.
Yeah, what does that mean? For me, I'm not a morning person. So the mornings are just awful. Like 9 o'clock, I have to have my coffee, but kids can't sleep that late. Like they do wake up early. So what is too early?
Yeah. So what is too early? Well, theoretically, the day doesn't start until about 6 o'clock.
Okay.
So 7 o'clock is a gift.
Okay.
Really it is. And most babies and toddlers who aren't feeding through the night anymore generally don't sleep much past 7 o'clock.
Okay.
Like when I'm talking to a parent, and if their child is older than like 6 months or basically anybody older than 6 months, if I hear that their child sleeps till 8 o'clock, I already know there's multiple night feeds in there that's manipulating the sleep to make it last longer.
Got it. Because it's just not normal for a child that age to sleep till 8 o'clock.
It's not very common. It's very uncommon.
Wouldn't that be fabulous?
It would be fabulous.
If you could get up and have a cup of coffee before your child.
Well, I don't know about you, but I haven't had an alarm clock.
No, my alarm clock is mommy, 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 just in that tone.
Oh, that's
just
beautiful.
like that. Yeah, it's great.
That's lovely. That's very nice. Look at you. Look at you.
But they sleep pretty well, actually. It usually comes around 6:45, 7. So I can't really complain.
No, you can't really complain about that. 5:30, 5 o'clock, something's going on.
Okay.
And you could think that in general, kids wake up between 6 and 7 o'clock just because of their circadian rhythm, their hormones, and the sun. Okay. So when you're getting to that 5:30, I want you to ask yourself, what am I missing or what's bugging my child that's causing him or her to wake up this early?
And these are going to be the 5 reasons of the things that you should think of first.
Yes.
Okay.
So the first one, I guess, would be, and the most common one, is that your child is overtired. And we talked a little bit about this last time too. What is being overtired?
Right.
Well, it's when your child isn't getting enough overnight sleep and a total number of nap hours during the day for their age. Right. And over the course of a number of days, like one day your child doesn't get enough sleep, most of us make it up the next day. But over the course of a number of days, if this is happening, you get into that overtired zone. And what that looks like is taking a long time to fall asleep, those night wakings, and those early morning wake-ups, 4:30, 5 o'clock. It's almost like they surface from a sleep cycle, and then they're distracted by being so tired that they can't relax back down into sleep. Okay. Kind of like feeling wired, and they just can't relax because they're still tired.
So the theory, I'm just going to keep my kid up later.
Yes.
So that they're really tired and they sleep in. That is like not true. That's terrible.
Yeah, I've tried that.
Terrible.
I don't know. I think everyone's tried it.
Of course, we all try it because it makes sense for us. Like if I stay up really late, I'm gonna be really tired. I'm gonna sleep in. Yeah. But for kids, that's not good.
We still go by sleep to get sleep. The more well rested they are, the easier it is to get them to fall asleep and then stay asleep.
Okay.
But also another great adage is kids who go to bed late wake up early, and kids who go to bed early wake up early.
Okay. So kids just wake up early.
Yes.
Okay.
Yes. Now theoretically, right? Like 6 o'clock is kind of your your gold standard. 6 to 7. 6:30 is very, very average.
Okay.
The 5 to 5:30, it's like what's bugging them? Why are they getting awake so early? And generally, most commonly, I'll say, okay, when is your bedtime? And if you look back, it's that they're staying awake generally too long before bed. So that's the most number one common parenting error is this bedtime that's based on, when dad comes home, when the family eats dinner, but it doesn't necessarily work for your little guy. Like for example, like a 10-month-old, their maximum awake time is like 3.5 hours. So if he woke up at 3 in the afternoon, he needs to be back asleep then by 6:30 at night. So if he's going to bed at 8, well, we already know he's probably going to wake up
overtired
and then wake up.
Okay, so that makes sense.
So the fix right there would be get him going to bed at 6:30. He's getting that extra hour and a half of nighttime sleep to help him.
Right.
Another way to think about it is your baby and toddler needs 11 to 12 hours of overnight sleep.
Okay.
And the average is 11. Like 12-hour sleepers, they exist and they're kind of like unicorns.
And when does that start? Like when can you say?
From like 3 months.
Okay, so from 3 months until they're like my 4-year-old.
Yeah,
and he should be getting 11 to 12 hours at night.
Your 4-year-old, he's probably closer to 10 to 11 by 4 years.
He's about 11, yeah.
Yeah,
okay.
But your 1-year-old, your 2-year-old, 11 to 12 hours, probably closer to 11.
Okay.
And then they would be closer to their maximum nap range, which would be like an hour and a half to 3 hours.
Okay.
For toddlers, what they're looking for over the course of the day. And the 11 hours, like, you know, if you get into the newborns, they need like 18 hours of sleep overall. And then it drops down to like 15 hours by about 4 months. They need 15 total hours over 24 hours of sleep.
Okay.
So the other way to think about it too is like, you know, is my bedtime appropriate? Well, I know my child wakes up consistently every day at like 6 o'clock. Is she getting enough sleep? Well, is she asleep by 7 and not waking up through the night? Count backwards can help you kind of evaluate that. So yeah, so being overtired is the number one.
Okay, so that's the number one, being overtired. We have some people saying hi. Sorry, I just wanted to check in really quick. See if there's any questions here. People are
12 hours, I wish.
Yeah, exactly. I know.
I never had a 12-hour sleeper. It was always 11 and then the maximum nap time to reach that 24-hour goal. And if they have 12 hours of overnight sleep, here's a way to think of it, Mercedes. If they have 12 hours of overnight sleep, you're probably having less nap time. And I don't know about you, but I needed the nap time.
Yeah, you need the nap time too. It's a balance. It really is a balance.
Yeah, it is balance.
Okay.
So that's the number one reason.
Okay. Do you want to get a question here? I have a question, or we can do the number 2. What do you want to do?
Let's do her question.
Okay.
Pam asks,
at what age can you stop afternoon naps?
Can you stop afternoon naps? So it's child dependent. It's usually child led. So what is the number one sign that your child is ready to drop the afternoon nap? It's when they're not settling until like 9:30 or 10 o'clock at night. They're not tired.
You're not tired enough.
Yeah, you're not tired. So that's the first sign that she's ready to go. And it's somewhere usually between 3 to 4 years. And don't be confused with nap resistance that can happen like 2.5, 18 months where they fight that afternoon nap. It's not a sign that they're ready to let it drop. It's just a developmental thing that they're going through.
Right.
But yeah, somewhere around 3 to 4. And that's when you might start like limiting the nap length to maybe
just to see
how that affects the bedtime.
Okay.
And then when you do drop down to no naps, it can be kind of a little rough transition. You're gonna have to have much earlier bedtimes, and sometimes it's never really black and white, right? Like nap transitions is not like one day they're napping, the next day they're not. They might not nap at daycare and then nap on the weekend.
At first, when we dropped my older son's nap, he napped every other day.
Yeah.
Like as a kind of a transition, and then it became every few days he needed to take a nap.
Yeah.
And now we just have quiet time. Yeah. Which he has to have just to kind of like regroup.
Yeah, that's good.
Yeah.
That's very good.
Okay, so it's if they're taking a long time to settle at night, but usually happens between 3 and 4.
Yeah.
Okay. This is totally my life right now. My 4-year-old naps at preschool and then is up till 9 o'clock every night. Yeah.
And that's so hard because as parents, we just need a little down and a little time, and then they are not sleeping beside you, and they're not ready at all. So yeah, I would start talking to your preschool and see what you can do. And it's really hard too, right? Because preschools around here, like they want them to nap. They want them to nap. Yeah, it's so difficult. They're like, oh, we'll just make him lie down. But he's used to napping at this time now, so of course he just falls asleep. His body's on this particular rhythm. It's very challenging. Okay,
so let's get to the second reason why they wake up early.
Okay, the second reason is that they're getting teeth. So it's that same idea that they surface from a nighttime sleep cycle and then they're distracted by the discomfort in their gums, which prevents them from relaxing back down.
Yes, and this is hard because kids' teeth
all the time.
Right? I mean, just when you think you're done. I mean, even at 2, the 2-year-old molars come in and you're like, wait, what? I thought we were done with this.
Yeah. And molars are funny too, because I don't know about you, but I found like they don't really show you a lot of daytime signs.
Right.
So then at night, all of a sudden you see a finger going in their mouth and it's taking them longer to settle, and then you've got that 5:30 a.m. wake up, which is really tough.
And you just kind of have to ride that out.
You do, you do have to ride that out. I mean, you can talk to your doctor about pain medication, but most of them only last 6 to 8 hours. So when can you administer it to get that help?
Get that coverage?
I mean, I had my second was more malleable than my first, so I would go in at 3 a.m. and give her a syringe of Advil to help her through those 5 a.m. periods. But she would just roll over, go back to sleep. My son would never ever have done that. That would never.
It would have been a problem.
So you just have to get up and roll with it. Yeah, it's and like I remember watching Netflix at 6 a.m., right? Or like 5:45.
Yes.
You're like,
You
this is
do
gonna be a
what
long
you
day.
need to do.
Yeah.
That's the lesson today. You do what you need to
Well,
do.
and the other thing too is like a lot of the stuff you read about parenting and sleep especially is there's a lot of theory into it. Like I've been on other, websites where it's like your schedule is wake up at 7, asleep by 7. I'm like, I've tried that. That just doesn't always work with every child.
Right.
It really doesn't.
Right. And we've said this before, every child is very, very different, even between siblings. So just because something works for one child, it may not work for the other child, and that's okay.
Yeah.
And what works for your neighbor
doesn't
necessarily work for you, and that's okay.
Yeah. And it's our goal just to give you the theory and try and apply it and figure out what works for you.
Exactly.
Yeah.
Okay,
exactly.
cool.
So,
all right, so let's do the third one now.
The third one is motor development.
Okay.
So anytime your child's learning to roll or crawl or pull up to standing or walking, same idea. You get those early morning wake ups. And often you actually get two with that. You get a middle of the night waking that can last up to an hour where your child is seemingly content just like chatting or playing in their crib. And parents are always like, why aren't they sleeping? Like, what can I do to make them sleep? It's like, well, you've already done your work. You've taught them how to sleep. You've laid out the boundary. You set them up for success. Now you just got to let it play out.
Right.
Grab that pillow and put it over your head. Like, he's content in that.
And it'll go away.
And it'll pass too.
How long did these little periods of time last usually? These developmental periods?
A few weeks.
Okay.
Yeah.
And it probably depends on what they're learning how to do.
Exactly.
Right?
And I find that this, whenever you hear sleep regression, there's a cause. It's one of these things in general, right? And I find the ones in the toddler years, though, to be the more painful ones for some reason.
Yeah.
Like, I find 2.5 is kind of that cutoff when finally, that's when you might get them start sleeping until 7 o'clock.
Yeah, you kind of get a little bit of a taste of it, and then you get like a hiccup and you're like, wait, what?
Yeah. But even the hiccups, like 13 months, 15 months, 18 months, like there's always something. At 24 months, we've got those molars, and then finally 2.5 sets in, and it's like, yeah. So you're on the last one.
Yeah. Well, it's funny, when my kids learned how to stand, that was a huge mess. Because they practiced. They just pulled up, both of them. It was exactly the same in this particular situation. They both wanted, so they would wake up early and they would stand, like, look at me, I can stand, I learned to stand. I'm standing. And I was like, that's so great, but it's time to lay down and go to sleep. Yeah,
and
it's hard.
And people always ask me, what can I do about that? It's like, well, I would put them in a sleep sack, see if you can limit the mobility in the crib time, but not much.
Yeah.
Really, like you said, not
right
much.
out. Okay.
Yeah.
All right, let's check in and see. Here we go. Teething all the time. Yes, I know. All right, perfect. Mastering a new skill. All right, cool. So let's go on to the next one, the fourth one.
So the fourth one is, so sometimes when you're going through this like teething that lasts a couple weeks, and the thing with teething, right, is that the pain is always the worst before the tooth pierces through the gum. So it's kind of like a hindsight diagnosis. You're like, oh,
that's what it was.
That's what that was.
That's actually really hard too, because you think that there might be a tooth, but then you go back to feel and you're like, there's nothing there.
Exactly.
So it actually does happen before.
Yeah, it does happen before.
Okay.
So that's awkward. But then your child gets used to, waking up every day at like 5 o'clock. And then you've got the fourth common reason is habit. Their body just gets adjusted to this.
Right.
And so what can you do? So, you really want your room to be dark. You want to keep out the birds, like if there's any birds that you can hear, some white noise. And then, if you've had a sleep training technique that you used previously, you might want to do that, like interval checks.
Okay.
And then the other one that you can use is a little technique called wake to sleep.
Okay.
So we're trying to disrupt the body's natural wake-up pattern.
Okay.
So you would go in about an hour before your child normally surfaces. So say that child surfaced regularly at 5, 5:10, 5:20. So you would go in at like 4 o'clock in the morning.
And that sounds painful.
Yes, it is. And it's risky too.
Right.
What if you wake them up?
Right.
And you gently rouse them just so that they surface somehow. So they sigh or they roll over.
So they they get out of that cycle and then they go into their new cycle.
Into a new cycle. Yeah.
Interesting. So you're not allowing them to make that transition by themselves where they might wake and then be awake.
Yeah. You're changing it.
Yeah. That's risky though. Yeah.
It is
risky. They wake up and they look at you like, hey, what's going on?
And sometimes with kids who are still nursing to sleep, you could use it that way. You could just pick them up and feed them like a little feed real quick and put them back down because they're used to nursing to sleep. That's their MO. They'll probably go straight back to sleep. But I've used that technique a lot with my toddler at my baby at around 10 months with a lot of teething stuff after the teeth were through.
How long does that have to, how long would you have to get up early
Try
to do it?
3 nights in a row.
Oh, that's not bad. I was thinking it was like 2 weeks of getting up at 4.
Yeah, no, 3.
Just like 3 nights, and then it kind of gets their body in a new rhythm.
Yeah.
Okay.
Exactly.
That's a great tip.
Yeah. Depending on the temperament of your child. You know, you probably could. I had friends who would pick up their kids at night because they just wanted an extra cuddle. It's the same idea, right? You're just disrupting their sleep cycle somehow. And if you're holding them, that would, just ease them back into sleep that much more. But you're not waking them up. That's one thing. You just don't want to wake them up. And even sometimes if you're entering the room and the door creaks and you hear them shuffle,
that's enough.
That's enough. That's it.
Okay.
Wake to sleep.
You just want them to kind of move a little bit or take a breath.
Yeah.
Like a big deep breath.
Exactly.
Okay.
Exactly. All these tricks that we try to manipulate.
I know.
Right? Kids sleep.
How much time should we spend comforting them when they do wake up? That's a great question.
So if you do wake to sleep and it fails, or I know what you mean. You mean if they wake up at 5 or 5:30? I'm not sure if we're talking about the wake to sleep.
Let's see what she says.
With the wake to sleep, if he or she woke up, that would be very unfortunate. And then you would do whatever you normally do to get your child to fall asleep, like whatever you did for sleep training, intervals, touch pad, comfort, whatnot. It really depends on your child's temperament. So much of it depends on your temperament. And then let's say your child's waking up at like 5 and it's a habit, and you're going back. In that scenario, you're going back to your sleep training technique. I think this is what she's asking.
Yes.
If you're going back to your sleep training technique,
if they wake up naturally at 5 a.m. Okay, yeah.
I would try for at least a half an hour, at least.
Okay, before you let them kind of manage for a half an hour before you go back in the room. Is that what you're saying?
Well, no. Like, let's say I sleep train my child doing like intervals, and when they woke up at like 5 o'clock, I would wait maybe 5-10 minutes to make sure they're really awake, and then I would go in and I would be like, it's still sleepy time. Here's your lovey. Sleepy time, and then do my checks at like 5-10 until for like a half an hour.
Oh, got it.
Like basically,
I see.
5:45.
So you don't wait a half an hour. You do your checks in the interval, whatever you feel comfortable with, until about a half an hour, and then in a half an hour you decide it's
morning wake up, dramatic wake up, get them out, started for the day. Your nap would probably have to be a little bit earlier than usual.
Right. So you try it out for a half an hour, and then if they're up, they're up.
Yeah, they're up.
Okay. Okay. All right.
Yeah.
Okay. Perfect. I think that answered your question. So the last reason. What if your baby pees? Like, that is a problem. Like, pees through the diaper. Sometimes he wakes up. I know I just totally interjected that.
No,
but
I love it.
Like, sometimes my son will pull down his diaper. I don't know. It's really weird. Like, he's messing with his jammies. And then obviously the diaper will leak. And so he'll wake up early only because he feels wet. Yeah. It doesn't happen enough for me to go in at a certain time and change his diaper, like anticipating this. But it does happen every so often. That's
a bummer.
But that's not really a sleep issue.
No.
He's waking up because he feels wet, right?
Well,
so
I think the issue is he's pulling it down.
Maybe we should get some new jammies.
It's like a one zip.
It's like two. Okay, so let's get on. So what is the fifth reason?
Well, kids wake up early because it's a baby and a toddler, and like we go back to like
they're kids.
Yeah. What are your expectations?
Right.
Really? Are they kind of reasonable anymore?
Right.
Especially with the first one, that can be a really hard transition to those, adjusting your cycle to be waking up at 6 o'clock on a Saturday.
Yeah.
But that's what having a toddler is. There's a reason why all those like weekend play dates and stuff start at 9 or 9:30 because everyone's already been up.
Yeah. No, totally. And so you just have to kind of set your expectations.
I think so.
So that they're reasonable, and then you don't get disappointed. You're not setting yourself up for disappointment.
Yeah.
Okay.
Yeah, and just managing everything.
And just make really strong coffee.
Yeah, really strong. And go to bed early.
And go to bed early. That's actually really hard.
Yes,
Everyone says, "Oh, we'll go to bed," shortly after your kids go to bed. But I like to stay up and have like my, downtime.
Yeah,
it's hard. But that's really good advice. If they're getting up really early, you should get some extra sleep.
Yeah.
At least until you get through that transition.
Yeah.
Okay, so we do have a couple questions that were emailed to us, and we can still take questions live. Take that one.
This one says, if they need an earlier bedtime, how do we move it earlier? When we try this, my child just doesn't seem ready for bed, even when she's overtired. So I believe that, you do just move it earlier. If she's not ready for bed, that's hard to answer. She's not ready for bed. Why is she not ready for bed? Is she actually still overtired that she's wired? Because that's a very common sign for toddlers is like, they get wired when they're overtired.
Right.
You could do it gradually in 20-minute sections in general.
To slowly make
but most of my clients, when I see a bedtime that's too late, I'm like, first thing we do is bring bedtime up to shorten that awake time.
Okay, so I have a question. So what is a reasonable bedtime? I guess you would count backwards, right? As you were saying, depending on what time they wake up, you count backwards to see when the reasonable bedtime. And what is the average toddler? What time does the average toddler go to bed?
Okay, so if you think the average toddler gets up between 6 and 6:30,
okay,
and they need 11 hours of sleep, that works you back to what?
7:30.
Yeah.
Okay.
Asleep.
Okay.
Yeah.
That's asleep, but that's hard
Yeah,
though.
that's a 7 o'clock bedtime start
Right.
in general. Yeah, but you get the rolling.
Because we take, we do baths at 7, but he's probably not asleep at 7:30. He's probably asleep at like 7:45 because it's like bath and snuggle and story and jammies and
And if the bath is working for you, awesome. But I often tell parents like, you don't have to bathe them every day because it's hard on their skin. A lot of kids after newborn stage, it can wind them up a little bit. And it just takes so much time. It's a great time killer. Sometimes, you're just waiting for bedtime. You're like, oh my God, I just can't get these kids to bed. We're like, let's have a bath. Let's take a bath. Yeah, but you don't necessarily have to do it every day if you're running behind schedule because dad came home late or you had to pick up from daycare or whatever. You don't have to make it. And it's hard on their skin.
Yeah.
So just, something to think about.
It's weird though. I feel like if I didn't bathe my kids at night, it would mess up. That's like part of their nighttime routine.
Yeah.
I never thought about it that way. Yeah. It's interesting. Okay.
Wait, there's one more. It's from Carrie, who I know and like. So Carrie says, what do you do with multiple teething wake-ups throughout the night? Oh, I'm so sorry that's happening. She's the cutest little girl, this lady. Okay, so teething, right? I always like to think like, how can we help kids who can't help themselves? So when they're teething, they're in pain. So this might be a good time to talk to your pharmacist or your pediatrician about like Advil and ibuprofen. And I just had a discussion the other day with a mom of a toddler who's not far off, he's about a year. That Advil doesn't really seem to be taking the edge off. And then you might ask your pharmacist about, so I'm a chiropractor by training, so we're like low medication, except when it comes to talking about teething. I give my kids a lot of pain meds. You can sometimes stagger Tylenol and Advil. Again, talk to your pharmacist or your pediatrician about that, but that's something else to look into. The other thing I like is like if you have a really cold, put like a teething ring in the freezer. And have it, your child chewing on it during the bedtime routine to help numb the gums
before they are going to sleep.
Before they go to sleep. And then, middle of the night, what do you do for a really, really uncomfortable teething baby?
Yeah.
I think you have to offer more cuddles
and
more reassurance. And maybe that means holding her for a little bit and then trying to put her down before she's completely awake.
Right.
But, your presence and comfort offering that extra help.
And sometimes you just have to do those things and you have to break
all your hard work.
Yes.
Yeah, sometimes
because you have to intervene because these things are short-lived and it will pass.
Absolutely.
Okay.
And you've done it once, the sleep training, you can revisit it if you
I feel like,
and isn't this the time to offer comfort?
I feel like if you have a good foundation, you can do those little things safely.
Yes, I agree.
Yeah.
I
okay.
Agree. I hope that helps, Carrie. Oh, she said thanks. Hi,
okay, so we had a question. My son goes down at 7:30. And we do the put down and pick up sleep training method until about 8:15 p.m. He sleeps until 4:30 or 5:30 a.m. Ouch. Then he's up for the day. He usually naps for an hour to an hour and a half. How can I get him to sleep later? So we kind of touched on this.
Yeah, so it sounds like he must be a toddler because he's on one nap. She didn't give us his age.
Yeah, but she said he sleeps once for an hour to an hour and a half. Yeah, so he's probably a toddler.
Okay, and it sounds like she's actually sleep training him because
she's doing a method. Yep.
Pick up, put down. Which is interesting because pick up, put down method I find generally is the most successful with really young babies.
Okay.
Because when you get to the toddler years, you're picking them up, they're happy, you put them down,
they get mad. Yeah.
So it like just extends.
They're more aware.
Yeah, it's taking her 45 minutes. So so then what would she do what does he wake up at?
He wakes up 4:30 or 5:30.
Okay, 4:30, I'd be doing that pick up, put down method again. That's how I taught him to go to sleep at bedtime. That's what you have to do.
Because that's still like middle of the night.
That's middle of the night.
That's middle of the night.
Yeah.
I feel bad for her.
I do too. But I also think if he's on one nap, I would also probably start your bedtime routine much earlier because he's in a sleep debt, right? So
he goes down at 7:30, so maybe go down a little bit earlier.
Yeah, I'd even bump it up to about 6:30 for a few nights to try and get him more nighttime sleep to help with that early wake up.
Okay.
Yeah.
All right, perfect. My 12-week-old goes down around 8 by her choice. She wakes up once to feed at 3 a.m. and then wakes up again at 6:30. That's good, 12 weeks.
Yeah.
Okay, good job. She can breastfeed her back down for another hour, but is it really worth it? Okay, so basically her baby wakes up at 6:30, so she's asking, should she breastfeed her to get her to go back down to sleep a little bit longer, or should she just accept the 6:30 early wake up?
Yeah. So 12 weeks, she's doing great.
I know, I mean like high fives, that's great.
That's a huge, big, long stretch. And actually that 8 p.m. Bedtime at 12 weeks is very appropriate as well. And by in another month, it'll come down to about 7 or 7:30 again.
Okay.
She's right on that natural progression. And should she just get her up, or should she, manipulate it with the boot? It's kind of a tough question because she hasn't really gotten her 11 hours of sleep yet still. So that is kind of like a night feed.
So you could try to do it.
I don't think you can do anything wrong here. I think you can.
You're doing great.
Yeah, I think you can. Whatever's working for you at this.
So maybe try.
Yeah,
try. See if she feeds and she goes back down and it's successful. Great. If it's not, then you're up.
Yeah, exactly.
Okay. All right, here we go. I have one more that was sent in.
Okay.
Okay. Anyone successful with early wake up? The majority of my 13-month-old's life has been getting up and ready to party at 4:30. That's painful. That's in the middle of the night. 13 months old. He sleeps 10 hours straight at night and naps all over the place. Usually 2 naps, 45 to 2 hours in length. Okay, so he's sleeping two naps, but he's only getting 10 hours straight at night and waking up at 4:30. I don't know what time he goes to sleep. She didn't say.
So it must be around 6:30.
Yeah.
Okay, that's 10 hours. Okay. So what should she do? So, 13 months.
13 months.
Could be getting his first year molars, but has he always been doing this? I can't remember.
She said persistent.
So now
for a
we've
while.
got that habit happening, probably.
Yeah,
to habitual wake up, so you're going to break it. So how are you going to do that? So you could do whatever sleep training technique you did originally to teach him to sleep. You could do that at 4:30 in the morning.
Okay.
Or you could try that wake to sleep at like 3:30 in the morning, where you go in and try and break that
Only
habit.
for a few nights.
Yeah, 3 nights. Yeah. I might have to set your alarm forever.
Like a 2-week session.
Yeah. Well, that is really hard on the parents, right? Because it takes you forever to fall back.
Oh yeah, you just set your alarm for that.
Yeah, you have to set your alarm for that. But yeah, those are the 2 things that I would suggest. Because her bedtime's reasonable. He's napping well during the day. He's just getting up way too early. And I think a lot of the time, like I hate to say this, but we don't want to hear the tears at that hour, especially if there's a sibling in the house.
Oh yeah.
Right, because you're terrified.
We said the whole family.
That's going to wake everybody up. But I think, what else can you do? He can't get up at that hour. So you can try the wake to sleep because it's gentle.
Right.
And then if that didn't work, I think you just have to be like, dude.
Yeah.
It's not
you have to break the habit.
It's the middle of the night. Like, you cannot.
And so even if you have to have a painful couple of days of him really crying and maybe waking up the other sibling, you have to kind of push through and just do it.
Yeah, I think you do.
To get him to train
the
to get back down.
long-term benefit of it, of him being well rested and getting enough sleep for his health. You'll have to do that. Yeah.
Okay. All right.
Yeah.
Perfect.
Yeah.
Okay, so those were the ones that were emailed. Let's take a look. What about the red light, green light system? I love this system. We have this system. Do you like this?
Yeah, I do like I love okay to wake clocks. And you and I were just talking about this beforehand.
Yes. So here, I was asking her before we started the live. So my 4-year-old loves it. He understands the green light comes on. Mommy, I'm awake. Sometimes he'll come out of his room. Sometimes he'll just call for me, whatever. My 2-year-old doesn't know when the light's going to turn green. So sometimes he'll wake up a little early and he'll be like, Mommy, almost. Like this, you can say almost. Like, is it almost time? Because in his mind, he doesn't know if it's 5 a.m. or if it's 6:45. I have it set for 7. But you said there was another kind of clock too.
Well, there's a grow clock, and it has on the face, it has little stars. So it tells you the stars start to disappear as you get closer and closer to the awake time. So that helps kids.
Is my 2-year-old old enough to understand the moving, maybe?
That's a good question. 2.5, I would say yes. 2, hard to say.
Okay.
Hard to say, but at least he could look.
Yeah.
So that's helpful. And do they help in general? Yes. I think that's a great boundary for kids. And I often recommend it when you move from the crib to a toddler bed to get that clock as your new boundary now that the rails of the crib are gone.
Right. And that's what we did. And actually, the only reason why my 2-year-old has one is because he loves my older son.
Oh, cute.
Yeah, so I had to get him one because he's a little early for a red light, green light, I think. I don't know, maybe not. But he loves it. I mean, he points to it and says, green.
Yeah, that's really good.
Yeah.
And I don't think that alone is the answer. Like, you've probably done really good already communicating what your expectations are. You've probably done a really good job at making sure your child has self-soothing skills.
Right.
Because often, people don't realize it, but they're like rocking or nursing their child to sleep at night and then putting them down in the crib asleep. And then when they wake up at 4:30 or 5 in the morning, that child has no idea how to fall back asleep without help from mom or dad. And so you can't just let them cry or expect them to fall back asleep because you've been doing it for them. So,
this is what we kind of talked about in our last Facebook Live. You have to teach them how to soothe themselves.
Self-soothing skills. Yeah, exactly.
Yeah.
But it's another great tool in your toolbox is what that is.
Yeah.
Absolutely.
Okay, perfect. I think that's all of our live questions. Does anyone else have any more questions about waking up early? Did we get them all?
We got them all.
Oh, a lot of people are here. Hi, guys. Thank you guys so much for joining us, and we can keep the conversation going. We always really enjoy doing these. Thank you. Please check out Dr. Sarah Mitchell's website, Helping Babies Sleep. We're also going to be posting this on our YouTube page. Please continue to follow us on Facebook and Instagram. And we'll do another one next month.
Yeah, thanks so much for having me.
Thank you.
Okay.
Okay, bye, guys.
Bye.